So let's say you're sick and you've got an infection. So the first thing you want to do is call your doctor. Don't go in to see your doctor. We have limited amounts of what's called PPE, personal protective equipment, in other words, masks. 98% of our masks are made in China. Now, what a horrible situation to be in, but it is what it is. And so healthcare providers are going to need these masks, and if you call and inundate their area, they're going to have to use all these masks to swab you and test you, or just to interact with you. So the first thing to do is call. What they're going to do is find out if you've got a fever and a cough. If you don't have a temperature above 100.5 and you've got a cough and other symptoms, you should self-quarantine yourself for 14 days. If you're sick, if you have symptoms. If you have a fever and you have a cough, call your doctor first. They're going to ask you a series of questions to see if you really need to be tested. And I understand that everybody wants to be tested because they're scared, but we don't have enough tests. We really have to rely on the tests for those that we think are positive, so we know how to treat them. So let's say they think you're positive, you come in, you get swabbed, you're going to go back home. Now, the only reason you're going to need hospitalization is if your fever's out of control and you can't manage it, and you have such a bad cough that you can't control it, or you're not able to maintain your oxygen saturation. You're breathing constantly, you can't keep up. That's a different topic that we'll talk about later. But let's say we're going to be at home, we're going to be managing this. What your doctor's probably going to tell you is Tylenol 3 grams per day. So that's 2 extra strength Tylenol 3 times per day. And that's to help manage your fever. You're going to want to stay active to a reasonable degree and really engage in good pulmonary toilet. And that's where you clear your secretions, you cough, you practice deep breathing. You want to keep those air sacs open, and I'll educate you on more of that in our next video on how that works at the level of the lung. Next thing you want to do is stay hydrated. With an elevated temperature, you're going to burn off water content, and you need a full volume in your body to circulate your blood to clear this infection. You should drink enough water to go to the restroom every 2 to 3 hours with clear urine. And what you need to do is not go to the store and buy cases of water. You need to go to your tap and you need to drink it out of there. Unless you're in Flint, Michigan, our water is safe, and it doesn't make sense to drink bottled water because the amount you're going to have to drink is glassfuls every hour. So that's the next step. And then beyond that, everything we talked about before. Plenty of sleep, vitamin C, supplements, well-balanced diet, and then you have to practice really good hygiene to prevent other people from getting the infection, or if they do, a very small amount. So one of the advantages people aren't talking about is when you're quarantined with your family, obviously you're going to try not to give it to them, but they're probably going to get a little bit, and then they'll get immunity, and that's going to be the key for them going forward. So always call your doctor first. Don't be afraid to call them more than once. Every time you call them, they are recording it in a chart, and so you're not just being told to go away and hang up. So I hope that helps you, but remember, I know you want to get tested, but we don't have enough tests to test everybody. Everybody wants a mask, but those masks need to be reserved for healthcare workers that are actually taking care of infected people. And the good news is that you have an 80% plus chance that after you get through this, that you've now developed immunity and you're largely in the clear. And be sure you do the other things we talked about to maximize your immune function, and you're very likely to not have a really bad outcome.